going to cover the skull, the bones of the skull, and the landmarks that you need to know. So this is the anterior view of the skull, and the first bone that we're going to talk about is the frontal bone. So this area right here is the frontal bone. You can think of kind of like your forehead. The first landmark that you need to know is called the supraorbital torus, and these are your brow ridges. It's also called the glabella. This is an important feature because it's used for determining sex estimations, so keep that in mind once we get to Module 3. Another important feature on the frontal bone is called the coronal suture. And so we're going to move the skull into superior view. And as you can see, this squiggly line right here, this is where when you were an infant and you were developing, your bones were fusing. And so originally when you were an infant, this is where cartilaginous tissue was. And then bone took the place of the cartilaginous tissue, and there is the remnant of that cartilaginous tissue here. And this is called the coronal suture, and you can think of it kind of where the crown would go on top of the head. And this separates the frontal bone from the two parietal bones. So the frontal bone as an adult is just one bone. It's not paired. But on infant skulls, you will see a metopic suture that extends from the sagittal suture right here all the way down the frontal bone. But you rarely see that on adults. Another feature that you should be aware of is called the supraorbital margin, and this is the upper edge of the eye orbit. So it's hard to determine in a video, and it's easier if you have the skull and you feel this kind of sharp edge right here. See how sharp it is, or how blunt and bulbous it is. This is used in sex estimations as well. But because we're in an online context and you do not have a skull in front of you, I'm not going to have you use that trait when doing sex estimations. So right now we're in anterior view. Moving back to the superior view, you will see there is the sagittal suture that goes from the coronal suture back through the occipital bone to the lambdoidal suture. This sagittal suture is separating the two parietal bones. So the parietal bones are paired. The next bone we're going to talk about is the temporal bone. And many students think, oh, that's where my temples are because it's temporal, temples, but that's not accurate actually. So we're going to turn the skull in lateral view, and this is where your temples are, but that is not actually the temporal bone. The temporal bone starts right here and extends all the way down around. There are several landmarks that you will need to know that will be important for determining sex estimations, as well as other traits that are important for figuring out what kind of diet hominins ate once we get to Unit 4. So the first feature I'm going to talk about is called the mastoid process. And it's this big lumpy thing right here for muscle attachments. If you feel the back of your ear, there should be a bump behind your ear, and that is your mastoid process. And so let's check the inferior view. And here is the mastoid process in inferior view. These are important for determining sex estimations because on average, within an ancestral population, males tend to have longer and wider and more robust and chunky mastoid processes compared to females. The mastoid process is not to be confused with the styloid process, which is the more steak-like feature. The next landmark of the temporal bone that you will need to know is called the zygomatic process of the temporal bone. And so you might be thinking, wait a minute, there's another bone called the zygomatic. Why is this on the temporal bone? It's because the zygomatic process articulates with the temporal process on the zygomatic bone. So it's kind of like a switch. On the zygomatic bone, which is your cheekbone, it has a process called the temporal process because it articulates with a temporal bone via the zygomatic process. Another feature on the temporal bone that we talked about previously is called the external auditory meatus. Can you find the external auditory meatus? Right here. It's your ear canal. The next bone we're going to be talking about is the occipital bone, and this is quite large. So if we turn around and look at the posterior view of the skull, you can see that a suture separates the occipital portion of the skull, which is this area right here, from the two parietal bones. And this suture is called the lambdoidal suture. It's kind of fun to say, lambdoidal. And it separates the occipital bone from the two parietal bones. And if we move the skull in an inferior position, we're going to see some of the important landmarks on the occipital bone. One of which is called the occipital protuberance. And this is a projection on the back of the occipital bone. And this is also used in sex estimation because for males, it's usually sharper and or more robust than it is in females. However, as you will learn once we get to the sex estimation section of the course, it's not always straightforward. For example, my occipital protuberance is ginormous. It's really big. And it looks like it would be a skull that would be estimated male. But I have other traits that are more feminine. So once we get to sex estimation, you will learn how difficult it actually is to estimate sex. And there are many skulls that are in the middle. Another landmark on the occipital bone is called the nuchal crest. And so you can't really see it too well here, but it's this kind of shelf that goes along the posterior portion of the occipital bone. And once we get to non-human primates, you will see more defined and robust and sharper nuchal crests. But this is also a trait used for sex estimation because males generally tend to have more robust or sharper nuchal crests than females. Another very important feature when we look inferiorly at the occipital bone is what's called the foramen magnum. So this big hole right here, foramen magnum. And this is where the spinal cord meets the skull. This is going to become really important when we try to determine locomotion. Another landmark that's important on the occipital bone is called the occipital condyles, right here and right here. And these are smoothed, raised, rounded points of articulation that will articulate with the facets of cervical vertebrae 1, or atlas.